Welcome to Imaging at Olympic Park. This new state-of-the-art medical imaging and treatment facility has been optimized for diagnosing and treating conditions of the musculoskeletal system. This video will briefly explain what we do for a hydrodilatation. What we do. There are many ways to treat conditions of the musculoskeletal system. Your doctor has recommended a hydrodilatation. This involves the injection of cortisone inside a joint, followed by stretching of the joint capsule with normal saline. Cortisone is a powerful anti-inflammatory and pain-relieving medication that has been used to treat patients successfully for many years. Cortisone has an important role to play for inflamed and restricted joints such as frozen shoulder or adhesive capsulitis. Why we do it. Hydrodilatation is performed to relieve pain and restore normal mobility to the shoulder joint. We use digital X-rays to guide the needle tip inside the shoulder joint. Digital X-rays have far less radiation dosage than normal X-rays. Precise delivery of cortisone will maximize its effect and avoid any potential complications. How we do it. Our radiographer or nurse will call you through to the fluoroscopic section of the department where you may be asked to change into a gown and expose the symptomatic shoulder. Our nurse will ask some questions regarding your medical history and possible allergies. Discuss the risks and possible complications. Complications of a hydrodilatation are uncommon, but do include bruising, infection, and local soft tissue injury. Rarely, facial flushing can occur, but this is not serious and almost always settles down within a few days. You will be asked to sign a consent form. An X-ray is a safe and painless examination. You'll be asked to lie flat on your back on the X-ray table. Your affected arm will then be rotated outwards, extended, and placed by the side of your hip to facilitate the procedure. A sandbag may be placed over your hand to prevent any movement. The X-ray camera will be positioned over the shoulder area and an image taken to assess the anatomy and plan for needle placement. A doctor trained in hydrodilatation will be called upon to perform the injection in a safe and careful way. He will clean the skin before carefully placing a needle inside the shoulder joint under X-ray guidance. The in-reticular position will be confirmed using a small quantity of X-ray dye. The injection almost always will involve the administration of local anesthetic. Cortisone is then injected and the joint is gently distended with normal saline, similar to blowing up a balloon with water. The quantity of fluid injected will be determined in consultation with your referring doctor. The water will subsequently be absorbed back into the body. Patients often report a tight sensation or discomfort at the back of the shoulder, and this may travel down to the elbow whilst the joint is being stretched. Infection control is important to us, and we make sure the procedure is done with a sterile technique. Our facility and technique are compliant with and have been approved by the Department of Health Services. After my injection. After the injection, you'll be asked to remain in the department for a minimum of 15 minutes. You'll be given a drink and something to eat. It is recommended that patients rest comfortably for the rest of the day and not engage in physical activity for the following 48 hours. The local anesthetic can last for up to 8 hours. Patients often feel numbness or heaviness. When the anesthetic wears off, symptoms may return until the cortisone can become effective. The cortisone typically takes up to 7 days to work. It is also important to follow your doctor's instructions also regarding your rehabilitation program and follow-up. Complications are uncommon, but should they occur, please contact Imaging at Olympic Park, your referring doctor or general practitioner. Thank you for attending Imaging at Olympic Park. We hope your hydrodilatation is successful. Remember, if you have any questions, please don't hesitate to ask.